Hi, it's Jen here. So let's talk about mental health, which includes addiction. So mental health and addiction, of course, is a growing issue in Ontario and across the country. But here in Ontario, right now, mental health is not fully funded under OHIP, and addiction treatment is also not fully funded under OHIP. It's also important to note that safe consumption sites were just closed, and the closure was announced by the Ford government. They passed a bill. The bill was voted for to close the safe consumption sites by Karen McCrimmon and other Liberals. So that's a very important piece to understand when we're trying to have a discussion about addiction and about how we try to treat people and keep them alive. So a safe consumption site is an evidence-based approach, especially for people who are not ready for treatment, because people can sometimes take time to be ready for treatment. Sometimes people will never be ready for treatment, in which case it's appropriate to take a harm reduction approach. What that means is keeping people alive and preferably allowing them to take safe, to make sure the drugs that they're taking are safe, and to make sure it's done in a safe environment, controlled environment, so if something happens, then the interventions are possible. So the green plan is to have mental health and addiction care covered by OHIP, which it should be. This is a glaring gap in our publicly funded healthcare system, number one. And we also we intend, and we will reopen the safe consumption sites that were closed by the Ford government. For more information, please check out our platform. It's fully costed at gpo.ca. Thank you.